Welcome to Mastering and Guideline in Ultrasound and Echo. Hi everyone, here we have a patient, young, female, healthy, has been sent to the echo department for echocardiography, and due to those finding and basic primary studies, doctor requests bubble test 2 for rule outing any shunt right to left that can cause exertional dyspnea. As you can see here, we have at the resting bubble test is positive. First, what type of the shunt, intrathecal septum shunt this patient has? Right to left, only left to right, or bidirection? And what is your logic and reasoning? Second, when we have resting positive bubble test or agitated normal saline test, do we need to do Valsalva 2 or not? What is your reason for that? Second, when we do Valsalva, we did with Valsalva and it show again positive, but there is some differences. Can you mention and point it out what is the differences? And finally, what is the diagnosis? As you know, the echocardiography is main study for any patient with the shortness of breath, especially when it comes to the exertional and young and healthy people. In those, the reason for echo is first of all rule outing any significant valvular disorder, LV or RV dysfunction, and those type of the cardiomyopathy that's at the early stage at least they have exertional dyspnea. And another reason for that, for echo and especially bubble test, is rule outing right to left shunt. That at top of them is intraarterial septum defect, PFO or ASD, and shunt right to left. As in this case, patient has right to left shunt, very obvious in the resting bubble test or agitated normal saline test. The question was, can we, based on this test, can we say this is bidirectional or mono from right to left or what? As you can see, during some specific moment, as you can see here, the blood from the left side, left atrium, go to the right atrium and push away the bubble, and cause the defect on that area here, as you can see. So we have one right to left shunt and left to right shunt. So we have bidirectional shunt in this case. The second question was, do we need to Valsalva whenever is positive on the bubble test? Usually we don't do Valsalva in just only in those cases that we do bubble test for patient with stroke and or mini stroke, TIA. In those cases, we want to just rule out if the patient has paradoxical thromboembolic in the heart or not. In those cases, just we wanted to rule out that one. So if it's positive, means positive, most probably the cause of the patient with the TIA or stroke, it was this shunt. But in those cases with exceptional dyspnea, we have to do always Valsalva 2. For the most important reason is AV malformation, arteriovenous malformation, especially pulmonary arteriovenous malformation. In those cases, usually in the resting can be positive, negative, but with the Valsalva or exertional, that patient has exertional dyspnea, that is the reason. With Valsalva, it exaggerates that shunt and we can detect in the bubble test. As you can see here, after many beats feeling the right side, there is some bubble, significant bubble come from the left pulmonary vein. It doesn't matter upper or lower. Just here we have right pulmonary vein here. Here we have left, left pulmonary vein here, as you can see. So this patient The blood, when we inject IV bubble test to the vein, it goes directly, instead of the go capillary and take out the bubble. In the AV malformation, we have connection directly from the venous to the arterial. So the bubble cannot be absorbed by the alveolar and lung. So it goes directly to the pulmonary vein and then come show up in here, pulmonary vein entrance to the left atrium. Maybe you ask why is only one spot we have this, why we don't have bubble come from other vein? Because in over 90% of the cases, pulmonary AV malformation is solitary and unilateral. The single is on one side. In this case, it was on the left lung, so it come from here. The point of this study is that with this case is that always in those cases that we are going to rule out right to left shunt, we have to think about the AV malformation too and do bubble test with the Valsalva tool and don't rely only because it's positive. We have ASD. We have to rule out AV malformation too. That's with the Valsalva, it help us detect that one. Sometimes even, especially if not technical, very accurate, and we don't have very well bubble, it can be negative. So always we have to think about those technical problem too. Hope you like it. Up to the next time. Have a wonderful time.